Hello, this is Dr. Morris. I'm doing an exam review for the skeletal system. This includes both the axial and the appendicular skeletal system. I'll start with the laboratory portion of the exam and then I'll move into the lecture portion of the exam. On the laboratory portion of the exam, you should be able to recognize all of the bones that make up and comprise the skull. This includes the occipital bone, the parietal bone, the frontal bone. You should be able to identify these bony structures from any angle. You should also be able to identify the suture lines, which include the coronal suture, the sagittal suture, and the lambdoid suture. This is a frontal view. You can see better the frontal bone. Also, you can see the maxillary bone, the mandibular bone. You can also identify some bony landmarks on those bones, which I'll go into a little more detail about in just a minute. The zygomatica bone. Get just a brief view here also of the sphenoid bone, but I'll show you a much better view of that in just a minute. You should recognize each of the bones that comprise the orbit. You should be able to identify these small holes that are in the bones. These are referred to as foramen. You should be able to identify the supraorbital foramen. You should be able to identify the infraorbital foramen. You should be able to identify the mental foramen on the mandibular bone. Your laboratory question may ask for you to identify a bone, and then also on the same question it may ask you to identify a particular structure. For example, identify this bone. Also, identify this structure on this bone. Correct answer would be frontal bone and supraorbital foramen. Also, the nasal bones are located here. Also, you should be able to identify bony prominences. Go back one picture. This is the occipital bone. This is the external occipital protuberance on the occipital bone. And again, a sample question would be identify this bone, identify this structure on this bone. You should be able to give me occipital bone and external occipital protuberance. This is an inferior view of the skull. Should be able to again identify four primary foramen from this inferior view. One foramen is the foramen ovale. Another foramen is the carotid canal. Another foramen is the jugular foramen. And then you should be able to identify the foramen magnum. Again, you see a view of the external occipital protuberance. You also see these articulating surfaces. These are referred to as the occipital condyles. These are articulating surfaces. These will articulate with the atlas, which is the first cervical vertebrae. Should be able to identify the palatine bone. This is a much better view of the sphenoid bone. You should be able to identify it. In the bones, as we've talked before, you can easily identify temporal bone from here. Also, you should be able to identify the zygomatica process, zygomatica bone. Zygomatica process extends off the temporal bone. This is the actual zygomatica bone. This is a much better view of the sphenoid bone. You should also be able to identify this location, the sella turcica. You should know what structures sit at the sella turcica. Two important landmarks here, the crossing, the optic nerve, also the location of the pituitary gland, which sits here. Again, you should be able to identify this as the occipital bone, and you should be able to identify that as the foramen magnum. You should recognize these smooth surfaces, and I think I have another photograph that'll show it even better. Smooth grooves that lie within the bones inside the skull where blood vessels and nerves will course. You should be able to recognize the parts of the vertebrae. The body of the vertebrae, vertebral body, the spinous process, the transverse processes, spinous processes, the vertebral body, the vertebral foramen. You should be able to differentiate the different vertebrae that are in the body. Remember we talked about cervical vertebrae, thoracic vertebrae, lumbar vertebrae, and then the sacrum and the coccygeal bones. Each of the vertebrae have its own specific characteristics, and it should be able to help you to identify that on the laboratory exam. For example, the cervical vertebrae typically have a bifid spinous process, which should easily help you to recognize this vertebrae. Again, the parts are similar. Still has a transverse process, which you should be able to identify. Still has articulating surfaces. This is referred to as facets. Should be able to identify those. And the body, the vertebral body itself. And then the vertebral foramen, where the spinal cord will pass. Now note on the cervical vertebrae, you also have a foramen, a transverse foramen, where the vertebral artery will course. This is not seen on the other vertebrae. You should be able to know the difference between the cervical vertebrae 1 and the cervical vertebrae 2. Cervical vertebrae 1 is known as the atlas. You should know both names. For cervical vertebrae 2 is referred to as the axis. You again should know both names. Should be able to recognize and identify this ligament, the transverse ligament, which holds flush this bony process referred to the dens. You need to know the name of the dens. The other name for it is the odontoid process. But you need to recognize that the purpose of the transverse ligament is to hold the dens in close approximation with the first cervical vertebrae or with the atlas. So the axis contains the odontoid process. The odontoid process will articulate with the first cervical vertebrae, the atlas, held into place by the transverse ligament. This table is out of your textbook. It helps you to identify the three different types of vertebrae. Again, you should be able to differentiate between the cervical vertebrae, thoracic vertebrae, and the lumbar vertebrae. Each has its own specific characteristics which should help you to identify it. For example, the thoracic vertebrae has articulating surfaces here for the ribs. Thus, it has a inferior costal facet. This is a point of articulation with the ribs. Same spinous process. The angulation, as you can see, is much different than what you saw in the cervical vertebrae. Also differs from the lumbar vertebrae. Also, you see that the spinous process is not bifid, as you saw in the cervical vertebrae. And then you should easily be able to identify the transverse processes here as well. Same vertebral foramen. However, you see strategically what is missing here is the foramen which the vertebral artery will course. So you don't see that location here as you saw on the cervical vertebrae. This would be a lumbar vertebrae, and again you can see the architecture has changed somewhat, but again you should be able to identify the key parts of the lumbar vertebrae. You should be able to tell the difference between the lumbar vertebrae and the other two that we just mentioned, the cervical and the thoracic. You should be able to identify this bone, the sacrum, and the smaller bones lying inferiorly, the coccygeal bones. You should be able to identify these openings on the bone, which are foramen, sacral foramina. You should be able to identify this bone. It's known as the clavicle. You should be able to identify both ends, the sternal end and the acromial end, noting that the acromial end lies laterally and articulates with the acromion process of the scapula. You should appreciate that the sternal end is also referred to as the medial end, and it articulates with the manubrium of the sternum. Should be able to identify this bone, the scapula. You should be able to identify several landmarks on this bone. These landmarks include each of the borders, the superior border, the medial border, also called the vertebral border, and then the lateral border. You should be able to identify the two processes, the acromion process and the coracoid process. You should be able to identify this smooth articulating surface of the scapula which articulates with the head of the humerus. This is referred to as the glenoid cavity. You should be able to identify the three major fossas on the scapula. This includes the subscapular fossa. This is on the anterior surface of the scapula. You should be able to identify on the posterior surface of the scapula the supraspinatus fossa and the infraspinatus fossa. And then you should also be able to identify this larger bony prominence referred to as the scapular spine. And as you can see, the most lateral portion of that spine is the acromion, the acromion process. So you should be able to identify those structures on this bone. For the humerus, you should be able to identify the head of the humerus. You should be able to identify the intertubercular groove. You should be able to identify the greater and lesser tubercles of this bone. You should be able to identify the shaft of the bone. You need to identify the articulating surfaces on the bone. As you see here in the anterior view, you can get a good look at the capitulum and the trochlear. Point of articulation for the olecranon process on the lower bone in the ulna. But you should recognize and be able to identify this articulating surface seen here anteriorly. And posteriorly, you should be able to identify the olecranon fossa, recognizing that this is the point of limitation for extension in the elbow joint. The olecranon process, which is located on the ulna bone, reaches its maximum point of extension because the C shape or the U shape of that bone actually locks into position in the olecranon fossa. So you should be able to identify this region, and you should know that this is the posterior aspect of the bone. You also should be able to identify the deltoid tuberosity. Next week we'll talk about the muscles that insert here. The deltoid muscle actually inserts on this bone at the deltoid tuberosity. Should be able to identify the two bones of the forearm. You should know the medial bone in anatomical position. Remember, anatomical position, the palms face forward. So the palms face anteriorly. Thus, in anatomical position, the ulna bone lies medial, the radius lies lateral. So the ulna and the radius bone, if I ask you to identify those two bones, starting with the medial bone, you should list ulna, radius. If I ask you to start with the lateral bone, the lateralmost bone, you would start with the radius, then say ulna. Again, I may ask you to identify this portion of the bone and identify the bone, in which case you would tell me the olecranon process and the ulna. You should be able to identify this as the radius because of the radial head. You should also note that one side of the bone, or one aspect of the bone, is larger than the other. In the ulna bone, and this is important, and I believe I asked you a question on your written portion of the exam about this, the proximal portion of the ulna is larger than its distal portion. Or, as this picture shows, the superior portion of the ulna bone is larger than the inferior portion. You should also recognize the radius is just the opposite. The distal portion of the bone is larger than the proximal portion of the bone. You should be able to identify this group of bones as the carpal bones. I did not ask you, I'll repeat, I did not ask you each of the individual names of the carpal bone, but you should recognize this as a group as carpal bones. Point of articulation with the bones of the forearm, which include the radius and the ulna. And then also point of articulation is with the metacarpal bones, which brings me to the next category of bones. You should be able to identify the metacarpal bones. Again, with hands in the anatomical position. Anatomical position is with the palms facing out. You should be able to start with the most medial metacarpal and give me its name. The names need to be in the appropriate nomenclature, and as you can see, that nomenclature is Roman numeral numbers. So if I ask you to start medial with the metacarpal bones, you should start with Roman numeral 5, 4, 3, 2, 1. If I ask you to start laterally, you should start with Roman numeral 1, 2, 3, 4, and 5. Again, you must be able to name those bones in the correct order, knowing medial from lateral. You should also use the appropriate nomenclature. You should also be able to recognize the phalanx. As you can see, the distal portion of the first metacarpal bone would include two phalanxes, a proximal and a distal. All of the other digits have three phalanxes, both a proximal, middle, and a distal phalanx. So you should be able to recognize the difference in these. Going down to the lower extremities, we'll start with the hip bones. Hip bone is comprised of three bones, and you should be able to identify those three bones: the ilium, the ischium, and the pubis. Those bones fuse to form the acetabulum. So you should be able to identify this landmark as the acetabulum. You should know the three bones that make it up. Some landmarks of importance: the iliac crest you should be able to identify, the posterior superior iliac spine and the posterior inferior iliac spine, and the ischial spine. You should be able to recognize this foramen, the obturator foramen. You should be able to recognize the greater sciatic notch, and you should be able to recognize the iliac fossa. This is both an anterior and posterior view, and you can see the joint between the sacral bone and the hip bones in the positioning which it lies. Relationship between the ilium, pubis, and the ischium, again, and the sacral and the coccygeal bones. Should be able to recognize this as the humerus. Should be able to recognize this as the femur. Should be able to identify the surgical neck. Should be able to identify the greater trochanter and the lesser trochanter. Should be able to identify the head of the femur, the shaft, and again lower articulating surfaces, which will include the medial condyle, lateral condyle, and then superior to both of those is a medial epicondyle and a lateral epicondyle. One thing that I forgot to point out to you on the humerus, so you may want to go back and look at the humerus, actually is divided into an anatomical neck and a surgical neck. You should know the difference between those two locations on the humerus bone. So please go back and review that. This is the patella, pretty straightforward bone to identify. Then these are the two long bones of the lower leg. These include the tibia and the fibula. You should know which bone is lateral, which bone is medial. You should know which is the weight-bearing bone and which one has no weight-bearing responsibility. These are the fibula and the tibia. Should be able to notice and identify the tibial tuberosity located here. This point is felt just inferior to the patella bone. And these are the bones of the foot. Now these first bones, the most proximal bones, are referred to as the tarsal bones. I do expect you to know at least two of those bones. One is the talus, the other one is the calcaneus. You should recognize that the talus bone is a point of articulation with the tibia. Should be able to identify the calcaneus bone from both a lateral and a superior view. These are the other tarsal bones. There are also metatarsal bones. And just as I had you to learn the specific names for the metacarpal bones, I'm also asking you to know the specific names for the metatarsal bones. Now please note, the numbering system changes somewhat. Starting with the most medial metatarsal bone, that would be Roman numeral number 1 metatarsal, proceeding with 2, 3, 4, and 5. If I asked you to start lateral and name all of the metatarsal bones, you would start with 5, 4, 3, 2, 1. Ordering system is just the opposite of what you saw in the metacarpal bones. So make sure you're not confused by that. Now, you should also recognize the phalanx again. The metatarsal bone number 1 only has 2 phalanxes distal to this joint. That includes the proximal and the distal. The other bones have both a proximal, middle, and a distal. Should be able to identify those bones. Now, for the lecture portion of the examination, those of you who have listened to the review from last semester, this is identical material. For the axial skeletal system and the appendicular skeletal system, first I would expect you to recognize the function of both of those skeletal systems. You should know what bones comprise the axial skeletal system, and you should know what bones comprise the appendicular skeletal system. You should know the characteristics and function of the skull. You should know what 2 bones make up the temporal mandibular joint. You should recognize the myofascial pain syndrome that's associated with the temporal mandibular joint. That's called TMJ, or temporal mandibular joint syndrome. You should recognize the position of each of the bones of the skull. You should know the points of articulation between the occipital bone and what bones it articulates with. You should know the parietal bones and what bones of the skull it articulates with. You should know the frontal bone and what bones it articulates with. And you should know the temporal bone and what bones it articulates with. You should also know the anatomical locations of each of those bones. You should know that, for example, the parietal bone lies or makes up a part of the superior lateral surface of the cranium. For example, the occipital bone makes up the posterior inferior surface of the cranium. You should know the characteristics of the frontal sinuses. You should know what their functions are. You should know when generally these sinuses appear. You should know whether they appear in all individuals. You should also know where the olfactory smell receptors are located at in the body. What portion of the skull would you see those located at? You should know the general characteristics of the nasal conchae and what the function is. You should know the characteristics of a deviated septum. Where would you see a deviated septum? In what circumstances? What disease is associated with deviated sinus? I said it. What disease is associated with a deviated septum? That's chronic sinusitis. You need to know the general characteristics of the skull of the infant. You should also be able to identify, and I might put this actually on your laboratory portion of the exam, you should be able to identify the fontanelles on the infant skull. You should be able to identify the fontanelles. You should know what fontanelles are on the infant skull. You should know the differences in the infant skull in comparison to the adult skull. You should know which is the largest fontanelle in the infant skull. You need to know the purpose of the fontanelles and the purpose of that arrangement, how that helps in the development of the infant. And then you should also know disease processes that are associated with malformations of the skull or improper development of the skull, I think it's better said. We talked about microcephaly. We talked about hydrocephaly. For the vertebral column, you should recognize each of the curves of the vertebral column. You should be able to recognize abnormal curvatures of the vertebral column. You should know the anatomy of the vertebrae. As I alluded to during the laboratory portion of the course, each vertebrae has specific characteristics and you should be familiar with those. You should be familiar with the anatomy of the rib cage. You should know what the function of the rib cage is. You should know the three parts of the sternum. You should be able to list them starting superiorly to inferiorly and inferiorly to superiorly, the three parts of the sternum. You should know where the foramen magnum is located at, what structure passes through the foramen magnum. You should know the structure sella turcica. Sella turcica. You should know where the sella turcica is located at. What structures do you typically see there? You need to know what the function of the foramen are. Foramen. You need to know what the structure, foramina. You need to know what that structure is, and you need to know what the purpose of that structure. You need to know the bones that make up the pectoral girdle. You need to know the bones that make up the pelvic girdle. You need to know the difference between the sternal end of the clavicle and the acromion end of the clavicle. You should know the two processes that are located on the scapula bone. Two processes we've talked about in the laboratory portion. Should be able to identify those two. Should know its relationship with other aspects of the scapula. For example, where the acromion process is the most distal portion of the scapular spine. It is a point of articulation with the acromion end of the scapula, the acromion end of the clavicle. You need to know the articulating surfaces of the humerus, what the superior aspect or the proximal end of the humerus, where that articulates at, what portion of the scapula bone is that point of articulation. You need to know inferiorly or distally on the humerus, what bones the distal portion of the humerus articulates with. You need to know where the ulnar nerve passes. It passes at a particular position anatomically related to the humerus, the ulnar nerve. You need to know exactly where it passes through. You need to know where the styloid process is located at on the temporal bone. You need to know where the styloid process is located on the temporal bone. You also need to know where the olecranon process is located at, the acromion process, and the coracoid process, what bones those are located on. You need to know the location of the greater and lesser tubercle on the humerus. You need to know where the intertubercular groove is located and what structures pass through the intertubercular groove. You need to know what the purpose for tubercles are. You need to know what the purpose of the tubercles are, greater and lesser tubercles on the humerus bone. You need to know where the condyles of the humerus are located at and what their importance. You need to know where the olecranon process, where it articulates at, with the humerus? What portion of the humerus does that articulate with? You need to recognize clearly that the olecranon process is on the ulna bone. The olecranon fossa is on the humerus. You need to know where it's located at on the humerus. What anatomical location on the humerus is that located? I already explained to you during the laboratory portion, you need to know this for the lab, about the size of the radius. I'm sorry, the size of the, yeah, I said that right. You need to know the difference in the size of the radius and the ulna. Remember I told you that the ulna bone was larger at its most proximal aspect, smaller at its most distal aspect, whereas the radius is larger at its distal aspect and smaller at its proximal aspect. You need to know the point of articulation between the carpal bones and the two bones of the forearm, the ulna and the radius. You need to know that the carpal bones are that point of articulation. Remember I told you you did not have to identify the specific names of the carpal bones, but you should know that proximally the carpal bones articulate with the distal aspects of both the radius and the ulna bone. And then distally you see the points of articulation are with the metacarpal bones. You should be able to identify the metacarpal bones in their order even on the lecture portion of the exam, as far as which is the most medial metacarpal bone, which is the most lateral metacarpal bone, again in anatomical position. You should be able to identify the point of articulation in the ankle between the tibia bone and the metatarsal bone. And remember, there are two specific metatarsal bones I asked you to know. One is the talus, the other one is the calcaneus. You should be able to identify those two bones. You should know which one is the articulating point with the tibia. Remember, there are two bones in the lower leg. One is the weight-bearing bone, that's the tibia. The fibula has no weight-bearing responsibilities. You need to know what the bones of the pelvic girdle are. You need to know what is the articulation point between the femur and the hip. You need to identify the structure where we see the head of the femur fits into the hip and articulates, what that location is called. If you know that information, you should do well on the test. This ends the review for the axial and appendicular skeletal system. Good luck with studying.